We have a lot of faculty here at Stanford Health Policy that work on domestic health issues and health equity within the United States. I work on global health, and so I work on many of these same issues, but I work on them in middle and low income countries. That means I have different sets of collaborators and very different focused projects, but the ultimate overarching focus of the work is very similar on improving population health and promoting health equity.
One of the key insights that I've had in my own career is the realization that the health of populations and global health is inextricable from the social, political, economic events that are happening around where people are and where people live. That is manifest in a lot of our work around climate change, where natural environments clearly impact population health. Areas such as the research on armed conflict and war and its impact on population health. Areas around foreign aid, where relations between different countries impact population health, and even on political decisions around areas of family planning and reproductive health, where decisions in one place can have very long reach into the health of populations in other places.
So now we live in a world that we cannot ignore something happening in a very remote place and thinking it's not our problem, because it could potentially become our problem. And we've now seen that it cannot only be like one problem, it could be one of the biggest problems we have ever faced. Other people and other societies are suffering, so how can we make their lives better?
There are a lot of diseases that we know how to take care of very simply. Malaria, we have taken care of. Used to be here in the United States, no longer. Tuberculosis used to be the #1 cause of death in New York, no longer. A lot of these things require very basic care. The knowledge that we can really eliminate those diseases or reduce them to really, really low levels has been an enormously motivating opportunity for global health. The sense that we can change policies, change strategies, and really make a huge difference in those populations.
Something that's really important within the philosophy of the internal medicine global health track, and to me personally, is this idea that global health is not just about going overseas and helping people who have a different life than what we do. It's about going where the need is highest and helping clinically and focusing research to some extent on vulnerable, higher need populations wherever they might be. And our veteran population definitely falls into that group. Even though it's right here down the road from Stanford, the population of patients is much sicker and much more socioeconomically vulnerable.
I think we can learn a lot from our peers in terms of countries that are in the same socioeconomic status as we are. I think actually we can learn things from countries that are actually less well off than we are, because they do things more efficiently than we do, because they have to be more efficient in delivering their health care and figuring out how to solve problems in ways that don't cost as much money.
It's really important that we address policy problems and crises as they occur. For example, the immigration crisis has become an enormous issue, and one of our faculty has been helping make sure that children are cared for safely there. More recently, Ukraine was invaded by Russia, creating a refugee crisis on a vast scale. And again, our faculty began to work on this and help develop solutions for some of the most critically ill children.
It's been a privilege for me to work with a network of pediatric oncologists to evacuate children with cancer from Ukraine with their families and place them in high-quality cancer hospitals around Europe. My role has been as a senior advisor to this effort based on my experience working in complex political environments as a pediatrician.
The simpler we can keep it, the better.
The Stanford Human Trafficking Data Lab is a group that really crystallized around the idea that it's difficult to think of a more egregious crime against other human beings or a violation of human rights than human trafficking. It exists on astonishing proportions. There are thought to be more than 40 million victims of human trafficking in the world. We find this to be an overwhelmingly compelling issue to work on. The group of faculty and postdocs and other scholars here at Stanford and increasingly at other universities around the US and in other countries that are excited to collaborate with us. It's something I couldn't be more excited about, although it's a difficult issue for all of us in many ways.
We have to act. We need to develop good, smart programs based on the best analytic evidence. But there is an urgency to what we do. And with my colleagues around the world, and certainly here at Stanford, we have a strong collective commitment to act and to ensure that our work is expressed as improving the situation in the real world on the ground.